This is Karen, and today we're working on revolumizing certain areas of the face, primarily looking at the cheek area, which is going to help us reduce some of the fold formation there. We're going to work with a little filler right up in here, and then the last place we may add is right down into that area. So we're going to start, there are several ways to approach managing the cheek area. You can go directly through the skin, or today we're going to go up inside the cheek because I think it gives people a little bit more natural look. It's a little less uncomfortable and a little less bruising. So we're going to start there. Working the cheeks first. I'll do a little there, and then we'll see what we need to add to that area. And then the last area we may add a little bit to the jowl area. Okay. So you can stay just like that. Use my left finger on your cheek up there. Doing okay? And this material has a numbing medicine in it, so typically you don't feel much of it at all. Once in a while you might feel me a little bit on the bone, which is a little stingy, but then it actually numbs up relatively quickly after. Doing okay? Feeling anything? No? Okay. The product we're using today is Restylane. It's a great filler. It's very natural, soft. So besides going inside the mouth, there's several other ways, like I alluded to earlier, going through the skin. There's also a way to put it in without using a needle for the primary filling action as well. And I feel a little bit more comfortable with this way because it keeps the bruising down. And I don't know, do you think it's very uncomfortable, Karen? Plus, like I said, in my opinion, it gives a little bit more natural result. Sometimes you can still feel a little bit once I get a little numbing medicine, and it actually gets better relatively quickly. I'm assuming you're not feeling much of this at all, or just a little bit. So we've added volume to the cheek. It's softened our fold. We're a little deficient right here, right on the orbital rim, and I'm going to apply a little bit of injectable through an incision here that travels just along to that area. And that should add the volume that we're looking for to restore that. So what we've been working on is augmenting the cheek area, but also not neglecting our lower eyelid and treating what we call the tear trough area. I thought you might, that's all. Yeah, much better. So I'm using my left hand to feel where I want the filler to go. Doing okay? Okay. Maybe turn. I'm going to face the camera so you can see the difference between the height of the cheekbone on the non-treated side and the better height and how much we've been able to soften the fold. That's just less than 2 cc's or 2 mils on the left side. And then we'll be going to treat the right side, coming back looking at the folds, and I'll probably end up adding a little bit of volume there even after we've completed augmentation of the fold and the cheek. So, mouth closed, that's great. Again, feeling for left cheekbone, slide up. A little bit of discomfort, but not too bad.
I don't feel anything.
Okay, good. A little bit there. Doing okay? The benefit of having approached it a little different way is I can usually get this in and it's not nearly as uncomfortable for folks. So. Did you feel much of that? Okay, great. A little bit there. So if you do feel a little bit, then I'll usually put a little bit of injectable filler down, and if I go back over it, it's usually numb. So try to do as few pokes as possible, because anytime you place the needle through the skin, it risks getting a bruise. So. Again, I'm using my left hand so that I can feel that the filler is going where I want it to, and I know how much I'm getting in. Doing okay? Mm-hmm. Feeling much of that? So we're also going to treat the glabella. At rest, Karen has a little bit of a depression and a furrow. Although that responds reasonably well with Botox, I think to get the best result, adding a little bit of filler there, such as Restylane, which is what we're using today, and some Botox will give her the best result. So right now I'm going to work on not only filling the lines, but actually adding just a little bit of volume to that area. So for me, it's easier to start on the left side of Karen, and then small poke. Once I get it a little bit numb, then it's not really that uncomfortable. Let me fill this just a little bit. And again, I try to minimize the number of pokes because they all make it a little more uncomfortable, and there's a little greater risk of bruising every time I make a little poke. So try to do it all through one if I can. To just feel and make sure we're okay. I'm going to come back and put a little bit more filler into that crease there so it keeps things even and smooths it out, but I think we've added a nice little volume up on top. Will help her out, and then that will be treated with neurotoxin at another visit. So far, worse than you thought, better, or about what you expected?
That's about what I would have expected.
Okay, alright. Is your look numb at all?
No.
Okay, good. Do your eyes feel goofy when you blink?
A little bit on the corners.
Does it feel like you're puffy, like you can see your cheeks now?
No.
Because that's very normal. Okay, so we're sitting back up, which gives us a better idea about the cheek area and the fold. One of the primary areas of concern for Karen was the fold, and although I somewhat convinced her to add volume to the cheeks, it definitely helps soften the fold. We're going to come back and put a little bit of volume in there. I don't like to overfill this area because you can get what's called a simian look, or a little bit more masculine characteristic. So I really like to work on volumizing the cheeks, bringing that back up. It helps soften those and gives an overall much more refreshed appearance. So small poke, this one you will feel a little bit. A little bit? Not too bad. So we're back. We've completed our treatment on the right cheek, the right fold, and we're going to add a little bit of volume to the left fold, and then we'll be done for this session. We may come back and put a little additional filler down in the jowl. That was my original plan. We'll let everything kind of soften a little bit and then reassess where we're at. Also, the benefit is sometimes they're still numb in this area, so they don't quite feel it as much if you do the cheek area first. Today I'm using a needle. A lot of the times I will use what's called a micro cannula to minimize bruising. That works out generally pretty well and a little less uncomfortable for the folks. So, all right, we're done. We've completed it. We've done a total of 1 cc in the glabella, half a cc in the left fold, half a cc in the right fold, and 2 cc's in each cheek and lower eyelid tear trough region. Great job.